We're going to discuss the anatomy of the lumbar spine, so let's jump right in. The lumbar region of the spine contains 5 vertebrae, 5 intervertebral discs, and a large amount of ligaments, muscles, and nerves. The large lumbar vertebral bodies are ideal for the heavy weight they have to bear. The disc and the adjacent end plates form a fibrocartilaginous joint that allows for small movements and acts as a major shock absorber in the spine. The posterior elements of the lumbar spine create the neural arch through which the spinal cord and nerves travel. These elements from anterior to posterior are the pedicles, the superior and inferior articular processes which form the facet joints, and the 2 lamina which join in the center to form the spinous process. Bony projections such as the transverse, spinous, or mammillary processes act as attachment sites for muscles and ligaments. The facet joints are classified as synovial joints. They transfer loads and guide and constrain spinal movements. The anatomical orientation of the facet joints permits some movement in all directions, but their interlocking nature provides a structural limitation for movements such as extension and rotation and checks anterior and posterior shear forces. A number of ligaments associated with the neural arch help limit spinal motion. These include the posterior longitudinal ligament, the facet capsular ligament, and the ligamentum flavum. Spinal nerves are the peripheral extensions of the central nervous system. They are formed by the union of the ventral and dorsal nerve roots that carry motor and sensory information respectively. The spinal cord itself ends around the first or second lumbar vertebrae, and the lumbar and sacral nerves fill the remainder of the spinal canal, forming the cauda equina. Each spinal nerve exits the spinal canal through the intervertebral frame and made up by the disc and the adjacent vertebral bodies anteriorly, the pedicles superiorly and inferiorly, and the articular processes and the facet joint itself posteriorly. Once the spinal nerves exit the spinal canal, they form a plexus of nerve divisions and unions and eventually combine to create larger nerves. The femoral nerve is formed by the segmental contributions of the L2 to L4 spinal nerves and supplies the muscles in the anterior thigh as well as the sensory innervation for the anterior thigh and the medial leg and foot. The obturator nerve is involved in innervating muscles and some skin in the medial thigh and is formed by the contributions of the L2 to L4 spinal nerves. The sciatic nerve, the largest nerve in the body, has segmental contributions from L4 to S3 spinal nerves. It provides innervation for muscles of the posterior thigh. The tibial and common fibular nerves are branches of the sciatic nerve that supply the muscles and skin to the